Hello guys. When it comes to USMLE, USMLE is the United States Medical Licensing Examination, and that will give you the validification for just not US, all around the world. You can work in most of the countries if you are cleared the USMLE. Now, there are three steps, and you are eligible to give the exam after your second year of medical education. Once you complete your second year in the medical school, you can give that. The step one is going to be just a pass or fail exam. There is no marks. When it comes to step two, it is CK. There is going to be the passing marks is going to be more than 214. And the step three, it's going to be a practical based exam and the passing marks is going to be more than 200. It's going to be a long process, so it requires a lot of perseverance. And those who are going to start early, they will perceive the things early. And when it comes to and this is just not a licensing exam, this is also going to give you the eligibility for the post graduation. And if you do all the steps just before completion of your school, and the earliest you apply for residency, the less the time lapse is there in between, your chance of getting the residency is more. So try to start early. And it's going to be a wonderful thing. Once you clear the step one, you will get into the momentum to clear the 2 and 3. Only the first thing is to take the first step. That is the difficult one, to take that step forward. Just not exam, the mental frame you have to change in your second year, that no, I am going to appear in the third year or fourth year for my step one. And then the things will roll down. When it comes to PLAB, it's going to be a two-step exam where you will be getting the license to work in the United Kingdom and many other countries, including the Middle East, Dubai, and all the Middle East countries. But this license is not valid for United States. This is going to be an easy exam if you compare with MLE. There are only going to be two steps. The first step, there will be 180 questions, 3 hours exam, multiple choice question. You have to score somewhere between 115 to 125. There is no as such specific marks, but this is what is average is you have to get more than 120 correct. When it comes to step 2, you have to go to UK to give that exam. It's going to be practical. There will be 18 stations. Each stations last for 8 minutes. For that, you can take a training of 2 months, 3 months. There are many programs are there in UK to train you for those step 2 OSCEs. But if you see comparatively, it is an easier exam. If you are in your final year and now you feel that you are very late for USMLE steps, because USMLE steps, it takes time, right? There are stage steps that ideally should be started from the third year or fourth year. Already you are graduated or about to graduate, then I would suggest to go for PLAB or MRCP. That is going to be a good choice because it is going to take less time. And once you get the registered in General Medical Council UK, then you can shift to Australia also for the better job opportunity, and more financials are better in Australia. But if you get registered in PLAB and in the GMC and then you go to Australia, you get more validification. There is more chance of getting the jobs there. When we compare the USMLE with PLAB, there are certain points that you should take care. First, duration. USMLE takes more time. PLAB is a shorter route. And as always said, the shorter route does not lead to more glory. It's the longer route that leads to more glory. That is why the USMLE is going to give you more financial rewards, more stability. So USMLE takes more time, PLAB less time. If you see financials, USMLE will give you better financials compared to PLAB. When it comes to visa, once you clear the steps, it's not that difficult to get the visas also. PLAB is also okay. The visa is not a big issue, but if you compare, yes, US visa is relatively more difficult than the UK visa. When it comes to the global opportunities, yes, definitely it's more with MLE because it's more glorified exam that is there. So always it's more there. When it comes to the research opportunities, again, it's more in US compared to UK. So overall, USMLE is going to win any day over PLAB, provided you are having the time and the money, because it takes money also to give the exam, because it will somewhere roughly cost you around 10 lakh of rupees to clear all the steps, because you have to travel to US, you have to do some trainings also there to get these things done. So it's slightly expensive exam compared to PLAB. Thank you.